understand, we have an informed consent previously of what I'm going to do. ¿Ok? Paola, voy a trabajar contigo, tú entiendes todo lo que hemos hecho y hemos practicado, ¿estás de acuerdo? Voy a colocar mis manos, cualquier molestia tuya, me avisas. ¿Ok? The first movement is distraction of the hip. So relax. Okay? My hands are positioned very close to this area, to the hip. And then I'm going to start with distractions. Grade 3 and grade 4, because I want range of motion. Grade 3 is large amplitude into resistance. And grade 4 is small amplitude into resistance. This movement help in this immobilization help in the next position is inferior glide to help abduction movement. Okay, the hip and the knee is in 90 degrees and she is in relaxed position. Okay, grade 3, we start with grade 3. It's a large amplitude into resistance. And grade 4 is a small amplitude into resistance. Alright. This another mobilization is an inferior glide and helps too in abduction movement. Okay? My hands are not in very distal, just in the tibial, at the end of the tibia. Okay? Voy a alar un poquito. Grade 3. Grade 3 is a large amplitude into resistance, and grade 4 is small amplitude into resistance. Right. Next mobilization is in prone position. Inferior glide helps to internal rotation. Okay? Un poquito más relajada, no tan abierta. Okay? Grade 3 is a large amplitude into resistance, and grade 4 is a small amplitude into resistance. Yeah. This is an anterior-posterior glide, and this movement and this mobilization help to increase extension. Right? Okay, voy a hacer un poquito de presión hacia abajo. Grade 3, so large amplitude into resistance. And grade 4 is a small amplitude into resistance. Mobilization is to increase flexion in the knee. Okay? Then grade 3 is a large amplitude into resistance. And grade 4 is a small amplitude into resistance. This increases knee flexion. Patella mobilization, the patient needs 20 degrees of flexion, is in an open pec position to increase medial rotation of the patella, and in combination with inferior glide to increase medial the natural movement of the patella. The first is an inferior movement of the patella. Okay, we can combine two techniques. The first with thumbs, inferior glides, or we can use my hand in this form to increase mobilization of the patella. Medial glide is another technique with my thumbs here, and this is the movement, inferior, medial movement, medial glide, superior, medial, and inferior movement. And we start with grade through is a large amplitude interresistance. Progress to number 4, small amplitude interresistance. A posterior glide to increase plantar flexion. That's the movement of plantar flexion. I'm going to stabilize here with this hand. I'm going to do the anterior posterior glide. Number 1 and number 2, because she have a lot of pain. To increase dorsiflexion, that's the movement that I want, and I want to decrease pain. My hand is put in this side, and the movement is in this position. Grade 1, progress to grade 2. Grade 1 is for pain modulation, and grade 2 for pain modulation too. And this help, at the same time, this help in dorsiflexion.